Health, Psychology, and Human Nature with Adhd Sturesson. Hey friends, hope you're having a great day. Are you following me on Instagram and Facebook? Please go to Health, Psychology, and Human Nature on Instagram or Facebook, or both for that matter, to get the latest episodes, inspiration, and more. Please take a pause and go there. Also, if you like the episode, please share it with a friend, family member, or somebody else who you think might like it. Welcome back, friends, to Health, Psychology, and Human Nature with me, Adhd Sturesson, a science-focused podcast where we explore, learn, and improve our lives together. Today we will talk about everything you need to know about ADHD, Attention Deficit Hyperactive Disorder, for both children and adults. We will talk about what ADHD is, how you know if you or someone else have the diagnosis, what treatment options exist, how to get an evaluation, the stigma around it, and a lot more. Dr. Roberto Olivardia is a clinical psychologist, a lecturer in psychology in the Department of Psychiatry at Harvard Medical School in Boston, Massachusetts. He also maintains a private psychotherapy practice in Lexington, Massachusetts as well, where he does work regarding ADHD, OCD, eating disorders, body image issues in boys and men, and other things. Friends, I really hope you enjoy today's episode. Roberto, welcome back.
Oh, thank you for having me. Always a pleasure.
It's always a pleasure having you on. And today we're going to talk about adult ADHD.
Yes.
It's going to be interesting, I think. I found some pretty interesting statistics. I thought that I perhaps should start off by mentioning some of them. But I found that 8% of kids and almost 4 or 5% of adults has the diagnosis, and that it is like 65% of people that are children also has the diagnosis when they become adults. And I've also found that it might have some quite serious effects, like living 5 to 6 years less because of different things like substance abuse or using more nicotine. And also, I also found that there's a pretty big comorbidity. So if you have ADHD, it's also likelier that you have other diagnoses such as depression and anxiety and things like that.
Yeah. So I guess in breaking down what you said, so first is that, yes, that prevalence statistics say about 8 to 10% of the population has ADHD. Now, what's interesting is that when you're talking about adulthood, so it really wasn't until the mid-90s that ADHD was even recognized in adults, which is kind of crazy when you think about it. I mean, it's almost as if people thought that once you turn 18, suddenly it went away.
Yeah.
And so a lot of the stats that actually say that, only 65% of children become adults with ADHD, the percentage is actually much, much higher. That in fact, for most people who have ADHD, they don't outgrow it, that you have it in adulthood. However, it looks different and it can manifest differently. So first, in terms of just what we even mean when we're talking about ADHD, is that I sort of divide it into different categories of symptoms. So one, we're referring to, so ADHD stands for Attention Deficit Hyperactivity Disorder. So there's symptoms of inattention, and that doesn't mean that people with ADHD can't pay attention to anything. It's that they can pay actually really good attention, or what we call a hyperfocus, on things that they find interesting and stimulating, but have very, very poor attention when it's something that they're not interested in. Now, certainly that's true for everybody to some degree, that if you're bored by something, you're not going to be as attentive, whether you have ADHD or not. But the difference is that for what we call neurotypical, so non-ADHD brains, I think of their attention as like a dimmer switch of a light, that if they're most interested, that dimmer switch, that knob will turn all the way to the brightest. And as they get less and less interested, they can sort of regulate. With an ADHD brain, it's like a classic light switch. You're either all on or you're all off. And I also have to say, I'm speaking as, not only a professional that treats people with ADHD, but as someone who I have ADHD myself. Yeah. I'm the parent of a son with ADHD. I'm the son of a mom who has ADHD. So I come from, as many people, it's in my my genetic lineage. So that was my experience, certainly when I was younger in school, that either a class was totally interesting and I could be the star student in that class, or I was completely bored and I was basically drooling on myself from just sleep and just being so out of it, or being a bit of a class clown to deal with that level of inattention. Part of that inattention is getting distracted easily, having a hard time sort of following through sometimes on multi-step tasks and kind of maintaining a level of energy and motivation, again, only towards tasks that don't hit a certain threshold of stimulation. The other piece of ADHD is what we call the hyperactive impulsive symptoms, which not everybody with ADHD has. So years ago, they used to call it ADD, which was the inattentive type. ADHD was the hyperactive impulsive type. And then there was the combined type. And now it's all called ADHD, but it's ADHD inattentive, ADHD hyperactive impulsive, ADHD combined. So the hyperactive impulsive type are those are the people that get identified earlier, certainly when they're kids. If they're the ones that are very restless, can't stay in their seat, bouncing around, high energy, like more than what you would typically see even in peers, their age. But not nowadays, though, we don't conceptualize hyperactivity just as a physical hyperactivity, that it can also manifest in a mental hyperactivity. So you might have kids that are staying in their seats that are often not identified because they're not bouncing off the walls. But in their minds are constantly racing, and they have a hard time even sort of collecting their thoughts. They are paying attention almost to too many things. And that's the strange thing about the term attention deficit. It's more of a misnomer. A lot of people with ADHD will say they're paying attention to too many things. Right. They're just not paying attention to the thing that they're quote unquote supposed to. And the impulsivity of people who act before thinking, and that could be verbal impulsivity, like interrupting people. It could be impulsivity, like running out in the middle of the street and not checking, if a car is coming down the street. It could be as an adult, somebody who's gambling, who's using substances, who are engaging in sexually risky behavior and in impulsive ways. And then the other piece is sort of this, what we refer to as the executive functions. The idea that, and this is something that's fairly new in the ADHD world, but understanding that all the cognitive processes that we need to achieve a goal are what we call the executive functions. So things like organization and time management and prioritization, emotional regulation, all of these things are affected, and basically what ADHD is. I mean, it's not in the diagnostic criteria, but it should be, because this is what ADHD really is. So when you think of sort of all of those, kind of aspects, is it's not that children outgrow it. It's that when we turn 18, most people will graduate high school, and then they go on in their lives, and then we have a lot more options as to what we do. And so those adults with ADHD are hopefully getting into careers that really suit their ADHD, that suit their brain, as I did. So I'm in a career where I'm meeting, I really enjoy people and enjoy working with people. I find it very stimulating. I'm working with a different person every hour of the day. I have a private practice, so I work for myself. So I, kind of pick my own hours. It's an ideal job for me. I mean, I'm getting instant feedback. I enjoy helping people. And so this is a job I'm very successful at. Now, you could put me in another setting and I would be dysfunctional. I mean, that when I was a teenager, I had many fears about growing up and being stuck in a job that I would hate, because that would be absolute misery to me. Now, again, keeping in mind, because a lot of times people think ADHD is over prescribed, overblown. yes, anybody who hates their job, it's not going to be happy. But there are lots of people that hate their job that can still do well in it, that still can do it. That's very, very difficult for people with ADHD. So I would say that a lot of adults also who live with ADHD were never diagnosed, especially if you're over the age of 30. When I was a kid, the only kids that were diagnosed with ADHD were the kids that were, considered the troublemakers, who had conduct disorders, who were at threat for later dropping out of high school, who came from very dysfunctional family backgrounds. And that was only a small percentage of people who have ADHD. Nowadays, we are better at diagnosing it and identifying it. But I often will see adults who don't get diagnosed until their children do. Their children get diagnosed, and then they think, I can relate to a lot of that.
Yeah,
and that actually
exactly.
reminds me of my experience. And they look back and they think, wait a minute, like I had ADHD as well. And I find it's one of those diagnoses of all the different diagnostic groups that I work with, the one that provides the most kind of aha feeling for people when they get that term and they truly understand it. It really, really explains a lot of aspects of a lot of struggles and challenges. There are a lot of strengths that can come with an ADHD brain. But like you said, it's important that most of the time people with ADHD will have an associated disorder. So 20% will have depression, 30% have anxiety disorders, 50 to 60% will have a learning disability like dyslexia, which is a learning disability that affects reading and writing and spelling. I have a son who's dyslexic. I'm probably on the mild dyslexic side myself. Was not a fan of reading growing up. Still really am not. And then I see people who struggle with cannabis dependence and binge eating disorder. But I also want to say out there that having ADHD doesn't mean you absolutely will get these things. However, that, Russell Barkley, who's the world's leading researcher on ADHD, who we owe so much to for all of his work, he said if your ADHD is not managed, then you will have some type of impulsive or addictive type of behavior. Now, sometimes it could be a more positive one, like someone who is really into running and exercise, as long as it doesn't get compulsive or dangerous, that could be good. Or someone who's really into their work and it's very productive. Because we need those dopamine levels, which is, we can talk about later, sort of what's happening in the brain. But if it's not managed well, it could absolutely lead to sort of more unnatural things like marijuana, gambling, sex addiction, and those kinds of things. But for any parents out there that might be listening to it, your kid isn't necessarily going to end up in jail or be an addict because they have ADHD. However, they do have a higher risk of addiction, and that's important to know.
Exactly. So it's something that is very important. I mean, perhaps we could go back to the definition of ADHD and really get into that, so people really can understand what the different components are. So perhaps if we could take the attention deficit first, like, can you give some examples of that, and how do you know if you have that component of ADHD?
Sure. That I would say, with that piece, it's really how well are you able to what we call regulate, which is a term we use a lot with ADHD. And by regulation, meaning how well do you feel kind of in control of that dimmer switch in that way, your attention. So all of us, again, have had experiences where we might be sitting in class and we kind of drift off and we have a hard time paying attention if we're bored or whatnot. But for people with ADHD, it's a very, very common experience. And again, one that is more measured not by the classes that they really enjoy, because this is also why ADHD is often misunderstood and can be misidentified or unidentified in a lot of ways, is if you ask a teacher, let's say, for if they're doing testing and they ask the teacher of the class of which that student finds that class very stimulating, how is that student? That teacher might say, oh, he's totally engaged and really, he's great. There's no problems there with attention. But to really do a thorough assessment, we have to ask the kid, what are the classes you're less interested in? And then we want to ask those teachers. Now, the difference would be for someone without ADHD, like I could tell you just personally, I remember in 11th grade history class, which I had a teacher who was super nice, but just really he was unengaging in his presentation, and I didn't find the content particularly interesting either. So that was a double whammy because if I liked the content and the teacher wasn't so stimulating, I might be able to kind of get in there, or vice versa. I might not like the content, but if the teacher was super engaging, that actually was probably the biggest factor. But I could get a perfectly good night's sleep the night before, the class before. I could be super engaged, and then I'd walk in this class, and within 5 to 10 minutes, my eyes would feel heavy, and I would just literally just fall asleep, like totally out cold, like fall asleep. And this is one of those sort of moments I think back at, because I remember after the class saying to my friends, "Oh my gosh, how do you find that class interesting?"
Yeah.
And they said, and these were my friends without ADHD, because most of my friends have ADHD. I mean, growing up, birds of a feather flock together. But the ones that, looking back, I know did not have ADHD, they said, "Oh yeah, we find it boring too." And I was like, "Oh, but you're awake." Like, I'm looking at them and they look totally engaged, and I know they're paying attention. I know they're getting, and they said, "Oh, but you can be bored and not have to fall asleep." And they were sort of laughing about it. And I thought, really? Like,
yeah, exactly.
How? Like, that was so weird.
Yeah.
And so that was a moment I remember thinking, oh, maybe there's something different about the way my brain works. Like, I'm either, because I would have the classes that I was super engaged, participative, and loved, but it really was like a very dichotomous, like, attention is very dichotomous for people with ADHD, and especially for kids, it can almost look oppositional sometimes. Like, if a kid is not interested, that they're just sometimes may act out. Like, I was a class clown. Sometimes I fell asleep in the class, and other times I would crack jokes and be disruptive. And my intention was not to be disruptive. My intention, I didn't realize, I couldn't articulate it at the time, but really was to just provide myself some stimulation. Yeah. And I love making people laugh, and I love to laugh, and laughter provides a lot of stimulation, except that wasn't always the best time or place to be doing that. But a lot of times when kids are doing that who have ADHD, they look like they're being oppositional or they're being troublemakers, and that's not really what it is. And I'm not excusing it. They need to have boundaries, obviously, and be told that that's not appropriate. But rather than assume these sort of negative character traits of them, to maybe inquire, is this a kid that's having a hard time sort of plugging in? And a lot of times, parents might say, "Oh, I don't think, he or she has ADHD. They're able to play video games for 10 hours straight." Well, yeah, video games are highly sensory, lots of visual, audio, tactile stimulation. That's an ADD person's dream. It's almost like video games. I bet you can look in the video game industry and find a ton of people who have ADHD, because they're the ones designing the games, because they know what that brain wants, in that way. So that level of inattention, it feels almost impossible, for people with ADHD, if they're not interested, inherently or naturally in it. Now, it's not impossible, and there are strategies we can talk about to sort of get through that. But it's important that there are just going to be some things that are inherently, like, it's almost like my brain is like molasses, around. And then there are things that are totally sharp and really cued in. And luckily, I found a career, and part of that was my senior year of high school. The only class I enjoyed in high school was psychology, and I took that class, and it didn't surprise me that I liked it, because I've always liked, again, people, and always liked helping people. But what surprised me was that I really liked it as an academic discipline, that this was something I academically wanted to read and read. And that was not my experience with any other class in high school. And I thought, oh, this I can study, this I can do. Because prior to that class, I wasn't a straight A student. I wasn't failing classes either. I was like in that mid ground. But I didn't really care about it. And I thought, why would I go to college when this is just not, like, high school was not a pleasant experience. Just, it was fun with socially, but it just academically. And so I almost didn't go to college. And then that psych class changed everything, for me. And then with, things like hyperactivity and impulsivity, again, everyone can say, oh, yeah, I was impulsive here or there. The person with ADHD, this is just their life experience that, most people with ADHD, especially the impulsive types, will often hear, like, why would you do that? What were you thinking? Like, those kind of questions come up a lot and sometimes even to the person with ADHD, they don't always understand why they did something when in retrospect they can look back and say, oh, that was kind of dangerous, or that was kind of crazy. But it's almost, what we know neurologically about the ADHD brain is that, our brains are actually wired in such a way that make it harder to sort of think through consequences. Now, again, these are all things that we can learn and we can develop strategies for, but it's just important for people to understand, this isn't an excuse, but it's an understanding that this is, there is a neurological underpinning to this. This is not something that's made up, that there's still, you can go on the internet and find people that say ADHD is not real. It's just not true. I mean, it's a very, real condition and a way of almost being that people with ADHD can very much relate to. And that impulsivity can come out in careless errors. It can come out in, again, sort of verbal interruptions. And because if you think about it, it's an executive function to be able to almost pause, think through something, look into the future as to what the consequence would be, take that information back into the present moment, and then guide your behavior. So let's say if you're in school, let's say, and a teacher, says something that makes you upset, a neurotypical person might pause and say, and in their head think, oh, I just want to tell the teacher to shut up. But they can take steps ahead and say, oh, but that won't serve me well, because then I'll get in trouble. And then these things will happen, not to mention the teacher might not like me. That might not fare well for the rest of the year. My parents will be upset with me, blah, blah, blah. And then they bring it back into the present moment. And then that guides their behavior to not say, shut up. The person with ADHD, those executive functions, it's almost like the future is like they're almost like time blind. They can't see that far into the horizon. So at that moment, they just think it would feel really good to tell the teacher to shut up right now. And it's that simple. Like, it's just, that's it. And so they say it. And then now maybe afterwards, once they hit their consequences, they think, oh, that probably wasn't the best thing to do. But in that moment, especially, when young people with ADHD, their brains almost are not only neurologically wired, like chemically, but also in terms of structurally. Our brains aren't fully developed until our mid-20s, with our executive functions. They almost can't see that. And so sometimes when they're asked, like, didn't you know you would get in trouble? And it's not that, one thing to also clarify, having ADHD and executive functions have nothing to do with intelligence. You can have people who are super intelligent in terms of high IQ who have very poor executive functions. I work with lots of people with ADHD that are like, genius IQs, but their ability to regulate attention, to manage impulsivity is quite poor. And that can be even more confusing because people around them, parents, teachers, friends, could be like, well, we know you're smart. So wouldn't you know that if you said shut up to the teacher or your boss, that there'll be consequences? And they're like, I know now, I guess. And in the moment, I guess if you asked me that, but my brain just didn't think of that. And people with ADHD, often, within the ADHD community, we make jokes of this, but it's also things that people have sometimes a lot of a lot of shame about things like missing appointments, losing things constantly, forgetting things like what we call our working memory, which is, you tell me, oh, can you go out into the car and get me my keys? And I'll say, oh, sure. And then literally 30 seconds later, it's out of my head, unless I've written it down or something like that. But yet people with ADHD have great long-term memory. So I can tell you every member of my first grade class when I was 6 years old and literally where we sat. I mean, I can picture it in my mind. But, many times I'll run to the supermarket to get something and I'll come home with everything but that thing. I've lost more sunglasses than, to the point where I just don't wear sunglasses anymore. I lose them all the time. And it's just become the joke, that and so it's an experience that is just, ADHD I see as a spectrum. It's not like pregnancy, like you have it or you don't kind of thing. Like there are some people that are more along that spectrum than other people are. And then it's so much something that's contextual too, because it depends on, what environment you're living in, the culture you're living in. What if you're in a school, that there are 25 kids in the class, your experience with ADHD will be different in that class than if you go, let's say, to a private school where there's 10 people in a class and you have more individual attention. That could totally change the whole trajectory. Like for me, college was a lot easier of an experience than high school was because I got to pick my classes. I was interested in my classes in psychology. The schedule, I wasn't sitting in a building for 7 hours a day. You have a class for an hour and a half, then you have 4 hours free, and then you have a class for another hour and a half. It suited me a lot better than what high school, was. So it was a different environment. And that's the other thing is ADHD is only is it's basically interacting with what's happening externally. And so that's why we still see in research that, adults, many of them outgrow it. It's like, no, they don't outgrow it. It's just that they now are in an environment that almost that better suits their brain in that way and provides them with a certain level of stimulation and meaning and relevance. People with ADHD.
Can't it also be that people that you have the symptoms when you're younger, but as you get older, you also learn these strategies to be able to handle different situations, and perhaps you also, if you get diagnosed, then perhaps also you get medication, which also lessens your symptoms. So it's still that you're still the same person, but you've learned these different strategies and perhaps take the medication for it.
Absolutely, that's very, very true. That, one of the things I say can be like an upside, I guess, of having ADHD is I've had to learn to sort of how to navigate through lots of different situations. And people with ADHD can relate to often because your brain feels like it's out of the box, it's not conventional, that you sometimes have to do sort of unconventional strategies to study or to, get through situations. But as a result, you really learn, and this is what I encourage, especially in my young patients, is we want to be open to that and accept that, okay, my brain is wired this way. Exactly. I don't want to feel shame around it. And this is largely genetic. But it doesn't mean I can't be successful. It doesn't mean I can't be happy, but I do have to work at it differently than somebody else does. And I have to be okay with that. But as a result of that, I have a very good sense of who I am and what works for me and what doesn't, because I've had to, like in that sense. And so you're absolutely right that, there are a lot of compensating strategies and factors that also, by the time you become for many people who become adults, that they sort of work at in some ways. And so I can, like, for example, I'm very good with time management. Like, I'm a very punctual person, but when I was younger, that wasn't always the case. I was late for school all the time, but I've learned a lot of strategies. So anytime I travel, for example, I don't just inherently have this internal clock that gets me to the airport on time or things like that. I have to write everything down. So if my flight leaves at 7 a.m., then I write, okay, what time do I have to leave my house by? What time do I have to wake up that morning? What time do I have to go to bed? And I have to see it all. And many people with ADHD, those we have to externalize almost and make it more concrete, because I don't sense that internally. So I have to really think through, if I'm going to be at my office by 9 a.m., I have to leave by this time because there's this traffic, and then I have to take that extra step to do that. But the result is the same. I'm punctual, and that's really what matters. And what gets in the way for a lot of people with ADHD is that shame, that lack of acceptance. But if you can accept it and work through it, and it's challenging at times, because again, sometimes you have to really go through different strategies until you find something that works. But you're right, is that for a lot of adults, they've compensated. They found ways around it, and once you do that, there's it almost opens doors for you.
Yeah, exactly. I mean, it really feels like it is. I mean, we're all different, and if you have a diagnosis such as ADHD, then you will have some strengths, and you will also have perhaps some weaknesses, and then it's right. I mean, then it must be a lot about learning about your weaknesses so that you can mitigate them, and then, as I understand, if you do that, then you won't have them. Kind of, from my understanding, ADHD is something that is very much treatable.
Oh, absolutely. I mean, that's the thing, is that it's actually one of, I would say, the most treatable things, because it's just, again, availing yourself to these strategies and different ways of behaving and understanding why you might be acting in a certain way. So, to me, I see treatment as education first and foremost around what ADHD is, what it isn't, what we know about the ADHD brain, developing strategies, and then for some, not all people, but a lot of people with ADHD, medication, stimulant medication, which when we say that word stimulant, to a non-ADHD person, those stimulant medications are like amphetamines, they're like speed, and they could be wildly abused. But to an ADHD person, the medication does not speed them up. It actually does the opposite. What it's stimulating is their frontal lobe, which is where all of our executive functions are housed, and it allows people with ADHD to feel more grounded when it's working, to feel more grounded, more connected to. It's like patients will describe it as that they're able to sort of do something for a longer period of time without getting derailed, without getting distracted. Even if it's something they're not interested in, they find, wow, I'm actually able to kind of tolerate this. I'm not falling asleep. I'm not wiggling out of my chair. And it's very powerful. So medication could be really helpful. And with stimulant medication, it's one of the most widely researched. It's been around for decades. And the beauty of it is that people know the day they take them, how they work. Unlike other medications for psychiatric conditions where you might have to take it for 2 to 3 weeks before you see its effectiveness, has to build in your body. Stimulant medication comes in and washes out very quickly. So if one doesn't work, because there are side effects to every medication, or if the dose is not good, you can adjust it, or someone can go off it, and within a day it washes out of their system. So of all the medications I tell people is worth the trial and error, it's this class of medications, because you don't have to invest like months to determine sort of the right medication or the right dose. But in addition to that, again, to emphasize that there are some people that either don't prefer to take medication, or medication isn't as helpful, or the medication sometimes could exacerbate a comorbid condition like anxiety, although that same medication could also help anxiety, because their ADHD is this, or rather their anxiety might be due to their ADHD symptoms. So if you treat the ADHD, they might have less anxiety. But the behavioral strategies and really almost helping anyone with ADHD, young, or older, to advocate for themselves, and again, just keep themselves open to, okay, I might have to do this differently, and I don't need to have any shame around it, because that honestly, that to me is the biggest obstacle that I see, particularly for older people. Young people now, the good thing is because there's better diagnosis, better identification, and less stigma for young people. Most of the kids I treat have friends that also have been diagnosed with ADHD. So they don't feel alone. They don't totally understand the full extent of what ADHD is in terms of executive function, or certainly how it might play out in their adult lives, but they're just more open to it. They can recognize it can be frustrating and challenging, but particularly with the adults I work with, there's a lot of shame. And part of that comes from, childhood where they might have been told they were stupid. They might have been told they were lazy, that they were crazy, that they weren't trying hard enough. And meanwhile, they were like, oh my gosh, I was trying so hard and it wasn't working. So maybe I am dumb. Maybe I am stupid.
Right. Yeah, exactly. So what would you say, like which ones, or what are the best treatment options for ADHD?
So it would be sort of, I say, a combination of certainly behavioral strategies and sort of, more of like what we call like a coaching, and trying to figure out, what are the areas that person has trouble with, because you can have 10 people with ADHD in a room and there'll be a commonality between all of them that they can have a conversation and find connection. And then there are going to be things that are wildly different about them. And so again, makes it hard for sometimes people to recognize it as a clear-cut diagnosis, because it manifests differently in different people. Because again, it's so contextual. It's so based upon that person's experience. So, for example, I have an older brother. He has ADHD. I'm the youngest. He's the oldest. I have a sister in between, and he has ADHD as well. But his ADHD is very different than mine. So, for example, when he's driving and if he's kind of getting lost or has to really concentrate, all the music, he shuts off the radio. He needs like total silence. So when we shared a room growing up, he was studying, he needed complete silence. And I am the total opposite. Like the music will go on and I'll actually be probably blasting the music.
That's interesting. Yeah.
And that actually doesn't distract me. It does the opposite. I'm more grounded by it. I've never written a paper in school without music on. It's very, very helpful to sort of just get my mind going. But both of us are doing what we need to do to concentrate and focus, but it's manifesting differently. So we totally can relate to each other on the sense of, there's a very narrow zone, optimal zone for us to be able to feel connected and grounded to this. And yet what we have to do to get in that zone is very different. And that's why we need to, even in the way we assess ADHD, there's still so much improvement that needs to be made on that front, because I come across and do consultations all the time with people who were said that they did not have ADHD, and then upon assessing them, I'm like, what, you absolutely have ADHD. Yeah. It's just that people weren't asking the right questions or really getting into the heart of what it is. And then medication could be helpful, but again, I don't think everybody has to be on medication, and I don't believe medication has to be the last resort either, where a lot of times people are like, oh, we'll use that as a last resort. It doesn't have to be the last resort. If you're really pained by certain symptoms, and if something is getting in the way of you being able to be successful, it's with the supervision of a prescriber, a physician, psychiatrist, nurse practitioner, there's nothing wrong with trying the medication. And I tell parents, there's no shame. Like, you have not failed your children by having them take medication. In fact, you're giving them what options are available, to them. And then another large piece is that self-esteem piece. I always that's probably the first thing I sort of look at for people, is giving them a lot of education, but really with the hope that they understand this is not about them being less than. It's very easy when you have ADHD and you're not totally understanding it to feel like you're at a disadvantage, to feel like you're not going to be successful in some ways. And I get that.
Yeah, exactly. So the different treatment options. So is it CBT and medication? Is that the two ones that are most effective in studies, or?
Yeah, they're typically cognitive behavioral therapy. There's some studies that are looking at DBT or dialectical behavior therapy that look at certain skills like mindfulness, emotional regulation, interpersonal effectiveness, and distress tolerance. That has been, DBT was originally designed for people with borderline personality disorder, but has been adapted to virtually every other issue and condition with good results. So I sort of integrate CBT, DBT, talk therapy, and then sort of like a coaching sort of aspect of like, okay, here's, sometimes patients will say, okay, I'm having trouble like writing a paper. And then we break it down, what are very practical, concrete, here and now steps that you can take, keeping in mind your ADHD brain, like keeping in mind that, what might work for your roommate who doesn't have ADHD might be different than for you.
Exactly. So that's my understanding as well from reading about this, that it's more the behavioral part of cognitive behavioral therapy. It's more getting strategies to be able to practically function better in your everyday life.
Exactly. Absolutely. Because, people can, even if they have the cognitive part down, like, okay, I'm not stupid. I just have a hard time, executing this project. But then it's like, oh, well, what do I do? Or rather, how do I do it? Because, we say with ADHD, it's not about knowing what to do. Sometimes it's doing what you know.
Yeah.
Like, I know what I have to do, but how do I just sit down and do it?
Yeah. And that must be the same thing. For children in school and for all other adults also in working environments where they are not very well suited. So that must be the problem.
Right. Absolutely. Like if you're in, especially for adults who are in careers that are not well suited for them, that's where you're going to see the ADHD symptoms become a lot more interfering. But even, for careers that are well suited, there's always aspects of every job that, isn't always going to be well suited. And so either, again, as adults, we have options. Sometimes we can hire people to do those things that we have a hard time doing, or we just kind of get through them, but we have a lot more motivation and incentive to do it than what might have felt like, for, let's say, a history class that we are like, I know I wasn't going to do pre-calculus in my adult life. And so I found that really difficult to sit with and get through.
Yeah, exactly. Why do I need this? Well, you just do.
Exactly.
That doesn't work. That doesn't work for me.
Yeah. Well, but that's what's important too, is so much of the education is really around the ADHD brain. And this is a scientifically, studied phenomenon, that this isn't just, hippie stuff, that we know that we have all these different neurochemicals in the brain, and one of them is dopamine, and dopamine is responsible for reward and motivation. So when we have adequate levels of dopamine available to us in our brain, we're adequately stimulated and grounded to be able to sort of almost kind of be still and focused with something. People with ADHD have less available dopamine in their brain. So at baseline, an ADHD brain is a bored brain. So because of that, an ADHD person is wired or oriented to their environment by what is going to stimulate me constantly.
Right.
Like that is so it's what's going to give me pleasure, but also what's going to stimulate me. So everything that's pleasurable is stimulating. Not everything that's stimulating is pleasurable. So anxiety is stimulating, but not pleasurable. Conflict can be stimulating and not pleasurable. And so sometimes even without intending, people with ADHD may even gravitate to those forms of stimulation because they're actually favored, or the brain, and this is not conscious to them, it's the brain favors anything but being bored and certainly looking for reward. And that's why people with ADHD at higher risk for any kind of addictive behavior, because all addictions neurochemically share the sort of this dopamine, deficit that you see.
Yeah.
So if you are craving dopamine, then any addictive behavior, whether it's binge eating, cannabis, gambling, sex addiction, all these things are elevating. What we find is that they elevate levels of dopamine. So that's all a person is trying to do. Now, if you're in a job, again, that provides a level of dopamine, then even in those tasks that might be less interesting, you might be able to get through because you're properly grounded. But if you're not, or certainly if school is not fun. Now, again, just to keep in mind too, I work with ADHD kids that really like school, and that again could make ADHD even harder to identify because they might like school but have a hard time with it, or they might be good students, but because they're really well supported by teachers and parents, but when they go off to college where they have less of that support, they can fall apart sometimes and wonder, how is this possible? I was a good student. What does this mean? But it's because maybe they were kind of had certain accommodations and whatnot, and then didn't realize how important those supports were, and so didn't replicate that model going into college. So that's the key. And then the other thing about the ADHD brain is there's another neurochemical called GABA, which if we have appropriate levels of GABA, we're appropriately inhibited. So that's the part that, that neurotransmitter that tells the kid, I'm not going to say shut up to my teacher. I'm going to inhibit that response. Well, the ADHD brain has low levels of GABA. So now you have a bored brain and you have an uninhibited brain by nature. So I tell people that again, and I've said this already probably 3 times, but not as an excuse, but it has to be put in the understanding for that person as well as people around them. Because as a parent, for example, it makes a huge difference if you feel that your child is doing something knowingly to just, push your buttons and annoy you, versus thinking, okay, yes, it's frustrating that my child, did this thing, but their brain is kind of wired that makes it difficult, to sort of inhibit that. Now, it doesn't mean you don't have the right to be frustrated or challenged by it, but it's a whole other thing when you think of your kid as being bad versus when you think, okay, they're not, their brain is not enabling them, to sort of do that. I mean, Russell Barkley says that particularly for people prior to the age of 25, that we have to think of their executive functions as a third less their chronological age because of ADHD. So if you're 18 and you have ADHD, some of your executive functions could be that of like a 12-year-old. Right. Not your intelligence, though. Again, that's what's so weird, is that you could be a super smart, intelligent person, but your room could be a total mess, or you could be late all the time, and people could easily attribute it to, oh, you don't really care about, time, or, you're a slob and those kinds of things, versus that person might have a really tough time engaging in those sort of executive functions.
Exactly. Yeah, that's really interesting. And one thing also, I think that you mentioned in the start, was that also if you have the diagnosed ADHD, then you can also super focus. So if you are a person with the diagnosis and you're really liking what you do, then perhaps you can get even more done.
Oh, absolutely. I mean, the hyperfocus, it's an interesting phenomenon that's talked a lot about as to, sometimes that hyperfocus comes because we've been procrastinating. Like, procrastination is a huge issue for people with ADHD. This sort of, oh, I'll do this later, I'll do it later, I'll do it later. And then suddenly, and they have, I remember just finding almost no motivation to get something done, like a paper done a week ahead of time. It just felt like I couldn't even sit down to do it. And then the night before, it was as if somebody injected me with adrenaline, because now there's urgency. Now the end is near. And I was, I used to write these papers.
The winter is
overnight.
coming.
Exactly. And I would pull all-nighters, which wasn't good for my health, to deprive myself of sleep, but I do it and I get A's on the paper. I do really well on it. Now, not everyone with ADHD can do that, so for example, like my brother wouldn't be able to mobilize his thoughts to write a paper overnight. I don't think he's ever pulled an all-nighter in his life. Now, as a result of that, he had to learn how to get stuff done beforehand because he couldn't pull it off at the last minute, which in some ways I was like, oh, I wished in some ways I couldn't pull it off, because then I wouldn't be in this situation all the time. It's so many times in college and graduate school, I'd be like, oh my gosh, this is the last time I'm going to wait till the last minute. I'm not going to do this again. And then sure enough, it would happen again and again and again and again. These 20, 30 page papers overnight. Now, part of it is writing is a strength of mine. So that I can be in the flow. But and then at other times it wouldn't just be this sort of urgency. It could be this hyper focus because I'm so into what I'm doing.
Yeah.
But to the point where you're ignoring hunger cues, you have to go to the bathroom cues, like you're so in it that it feels like an earthquake can happen around you and you wouldn't even know the difference. I mean, it's that powerful, that hyper focus.
Exactly. I think it was very interesting also just to what you said earlier about the medication, just that we got that also covered. So from my understanding, so it's the behavioral part mostly of cognitive behavioral therapy, and then it's also medications where you mentioned stimulants. So perhaps we could just go through that also. So stimulants, what are like the pros and cons of using stimulants, for example, with ADHD?
So the pro really is that what stimulants do is that they help someone feel sort of more grounded, that they feel like they have a better pause button, particularly for people who are impulsive or hyperactive, that they'll say, I might still have the, to crave gambling or overeating, but I feel like I have a better pause button. Or even for the kid, that they'll say, I don't like reading, but I could actually sit down now and read for 45 minutes straight, where before the medication it was 5 minutes. I mean, it can be dramatic for some people. I mean, that's the benefit of it is it's in such a short period of time, people can really see these incredible, differences. In terms of, so there are different kinds of medications, different kinds of stimulants, and there's really no rhyme or reason yet as to why some people respond better to one than the other. So that's why I tell people, if they're going to invest in looking for medication, there is a little bit of a trial and error that can happen in terms of, maybe Adderall doesn't work for you, but Ritalin might. And then you might have a sibling who has ADHD where Ritalin works for them and not, or rather that Adderall works for them and not Ritalin. And we don't know why. I mean, it's sort of, and then some people, unlike a lot of medications that are dosed upon body weight and how you metabolize, with ADHD, that's not the case. Even though a lot of people who don't understand ADHD still dose by body weight, I can have, a child patient at 9 who's on a higher dose of medication than a 40-year-old, grown man, because it really doesn't have to do with your body weight. It's really around, again, what's happening in your brain. So sometimes dosages, people might get scared thinking, oh, that seems so high, but it's not it's not doing the same thing that we traditionally think about sort of with other medications. It's high because the brain needs that kind of extra grounding in that way. There could be side effects. Sometimes, particularly for younger people, it can be an appetite suppressant. Now, in early research, they would say that stimulant medication can cause sort of stunting of growth. That's actually not true. That what was the correlating variable is that if your appetite is suppressed and you're not taking in enough calories in the day, that can certainly. So for a lot of kids who take medication, they'll have often a big breakfast and then, take their medication, maybe have a light lunch, but some of them aren't even hungry at lunch, and then have a big dinner. So that as long as you're getting the calories that you need, you're going to be fine. And then, there are other side effects. Sometimes people might notice sort of some irritability. But again, in my opinion, if the side effects sort of happen, then it might be worth trying a different medication to see, because, a lot of the patients I work with don't have any side effects from it.
And from my understanding, you only need 4 weeks per medication. You don't have to have tested medication for like 4 months or for 6 months, for example. Is that correct? Or?
Well, at least in the U.S., that they prescribe it in 30-day supply, and then you have to have because it could be seen as a scheduled substance, because there are lots of people who sell ADHD medication who people who don't have ADHD who abuse it.
Yeah.
People who have ADHD, I've actually never worked with an ADHD patient who abuses their ADHD medication, because it doesn't do the same thing to the brain. It's not psychoactive. And that's why there's a lot of irresponsible reporting or, shows that talk about, oh, you don't prescribe Adderall, to your ADHD kid, they're going to abuse it. It's like, no, the people who are going to abuse it are, let's say if your kid is selling their Adderall to their friends, who don't have ADHD, yes, those people, can abuse it. But it's almost like even if people were to take a little bit more of their Adderall, they're just going to focus more. It's not like it's going to make them, feel great and like in this kind of euphoric. It doesn't do that to them. But yeah, so they prescribe it in 30-day, supplies, but medication, unlike antidepressants, which you have to be taking daily, and some people on antidepressants might take them for 6 months. Some people take them for the rest of their life. With a stimulant medication, it totally varies. I mean, there are some kids that I work with, they only take their medication during school. And then on the weekends, school vacations, summer, they don't have to be on their medication, and that's fine. Other kids, they're always on their medication because school isn't the only area in which their ADHD can impact. They can be wildly impulsive, and it could be, dangerous for them, not to be taking their medication. Some people might take it for their lives, and they just see it as, this is what I need to do. It's no different than if I'm diabetic and I take insulin, or if I have high blood pressure and I take high blood pressure medication.
Yeah, exactly.
It's what helps me function. And then there are lots of people that once they're in an environment or have learned enough strategies that work for them, they can go off their medication and they're fine. So I always tell people it's so individual, and the goal is, obviously you want to sort of, whether you're on medication or not, we always say pills don't teach skills. Like, you're still going to need to learn how to navigate, these strategies, the behavioral part, the coaching part. The medication just gives you a better shot now of implementing those strategies that you can have. But I just never want anyone to feel, again, shameful that if they feel they have to take medication. I mean, there's some patients I have, they feel such gratitude that this medication exists for them, because they're like, oh my gosh, like I can do the things I want to do and feel normal, and whatever that means, but basically feel like they are able to execute certain things with the medications. And then some people are like, you know what, I'm going to try it. But I really want to focus on learning strategies, so eventually I don't have to be on the medication. And that's okay, as long as I just don't want them to feel less than, as a result of that.
For sure. I was also interested to know a little bit about testing of ADHD. So if you're an adult, and is there any scales that you can use to get a first glimpse if you might perhaps have the diagnosis or not?
So what's tough about testing is there are a lot of scales out there. There's like the Conners rating scale, and the ADHD rating scale, neuropsychological testing. But I always caution people that the best way to really get a diagnosis is meeting with somebody who's an ADHD expert, and doing sort of more of a clinical assessment and evaluation. Now, neuropsychological testing can be multiple hours, can be very expensive. And neuropsych testing actually is not a useful way of diagnosing ADHD. It's a very useful way for diagnosing learning disabilities. So for any student that has ADHD, if they're having sort of trouble, in school, I will often recommend some level of neuropsych testing either through the school, because 50 to 60% of people with ADHD have a learning disability, whether it's dyslexia, dysgraphia, which affects your writing, dyscalculia, which affects mathematics, processing speed disorders, things like that. But as far as ADHD, neuropsych testing actually generates a very high rate of false negatives. So people who have ADHD but don't test as having ADHD, because if you think about it, how valid is it when you're one-to-one with a tester and doing some of these tests, which can actually be fun, are very short, 4-minute or less tasks or tests, their attention and they're in this kind of contained environment, their scores are going to be much more elevated than taking that same student in a class of 20 kids with a task that's not 4 minutes long, but is 45 minutes long, and where the teacher isn't just paying attention to them. It's night and day in that kind of way. I mean, that's like testing me when I'm in that hyper-focus zone and assuming that's how I always am, which I'm not. So neuropsych testing is, we in the ADHD field, we're saying that could be one of many, aspects. I would say definitely for learning disabilities that can really be helpful. But as far as rating scales can be helpful to be an entrance where somebody could be like, maybe I should explore this further.
Exactly.
But I would never diagnose somebody just on how they do on a rating scale, because rating scales can also create a high rate of false positives, of people that say, oh my gosh, I must have ADHD because I endorse these 7 items. But meanwhile, I might meet with them, and this happens as well. So people who think they have ADHD, and I work with them and I'm like, no, they might have obsessive compulsive disorder, OCD. They might have anxiety, and the anxiety is the thing that's getting in the way of their attention. They might have actually, what we would see as kind of normative aspects of inattention. But maybe, there's something else, distracting them or things like that. Trauma can also mimic some aspects of ADHD. So there are a lot of things that can get in the way. Certainly if someone is using drugs or alcohol, that could certainly get in the way of a lot of these kinds of, symptoms. So it's a useful start to have someone say, maybe I should explore this further. But when I meet with somebody, I don't do neuropsych testing, but I will do more of a clinical evaluation. I'll ask them a ton of questions, but it's beyond the, how did you do in school? Oh, I was a straight A student. Okay, check. Against ADHD.
Yeah, exactly.
No, I will ask them, how did you get those A's? How difficult was it? Because you can be perfectionistic and be an ADHD person. Some of my ADHD people, I've worked with, kids and or adults who had ADHD and dyslexia as children and did very well in school, but they said they were working 6 hours on homework when they knew their friends were working an hour or 2. They were just driven and super ambitious, but it really came at they burnt out a lot of times. And so I inquire more on that. How did you study? Did you get things done at the last minute? Were you able, because I did well enough in high school that I got into a competitive college in the States, but even though I wasn't a straight A student, but I had a lot of leadership skills, and I write really good essays, and I interview well, and I know that's definitely what helped me get into that school. I did very poorly on my SATs, the exam that you take, to get into college. It's a 3-hour test, and I would have definitely benefited from certain accommodations, like taking it in a private room, having some breaks. I fell asleep the first time I took it for like a good hour.
yeah.
It was that bad, and I remember my guidance counselor in school said, you have to take it again. You did horribly. And I did. And I was like, oh, there's no way am I going to take that again. And I refused. And then I acquiesced, which was not a usual experience for me back in those days. And I took it again. And the funny thing is, I was awake in the full, but I only got 50 points higher. I just don't test well on those kind of tests. But thankfully, I got into a school that didn't, that didn't weigh that, as heavily as it weighed other aspects. But I ask them questions. When I ask them, like, sleep, many people with ADHD have sleep issues. How many hours of sleep do you get? They might say 8 hours, but then I'll ask further, what are those 8 hours? Is it from 3 a.m. to 11 a.m.? Is it from 10 p.m. to 6 a.m.? Do you get up many times in the middle of the night? Do you have a hard time falling asleep? Do you sleepwalk, sleep talk, have sleep apnea or sleep disorders? Those kinds of things. Any family history, we ask about family history. Now, keep in mind that, we're now in a generation of people that are getting identified earlier, but many of my young patients that I work with, they'll say, no one in my family has ADHD. That is very unusual. In fact, I've never seen it that, unless someone's adopted and they're not biologically related to people around them, but I will always see some biological, usually in a parent. I can only think of maybe 2 people of all the years I worked with ADHD that I didn't see it in the parent. Now, their parents might not be diagnosed, but as a good example, I worked with a young boy many years ago. And, his ADHD was pretty easy to identify, but I met with the parents, and the father was so frustrated with his son and saying, I don't understand why he can't just do these things. And I asked if either of them had ADHD, and I knew the mom didn't. She clearly was the executive. We say that there's usually like the frontal lobe or the executive
of the family. Yeah, exactly.
Right. And she was definitely it. And I asked him, and he said, no, I didn't have, I was a really good student, and I paid attention, and I, X, Y, Z. And I said, was that always the case? And he goes, well, when I was very young, I got expelled from preschool a couple times. And I was like, what? Like, how do you get expelled from preschool? And then he started telling me these stories, one where he lit a fire in the trash can of his preschool. And then the second time he threw the teacher's keys out the window. But what was sad about it is that his father, so my patient's grandfather, would physically abuse his son, which is my patient's father. And basically, my patient's father learned that if he was out of line, he was going to be beaten. And so he learned pretty quick out of fear to pay attention and to not get out of his seat and to not. Now, I said to him, well, thankfully, your son is not growing up in that environment, because this guy was a wonderful dad. He was a very loving father. He was just so frustrated. He just couldn't understand. And I said, we have this saying that sometimes people with ADHD kind of get the ADHD beat out of them in a way, but it's still there. I mean, this father, for a job, he's an entrepreneur. He very much fit all of the sort of personality characteristics that you see with people with ADHD. But until he really understood that, he thought, oh my gosh, that's absolutely true. Like, in a sense, if I didn't have that fear, and he still had it. I mean, there was a lot of trauma, in that. He said he could now sort of relate, to his son. So when I ask about family history, and people are like, nope, I'll ask further. What do you do for a living? Was school ever difficult? Are there, and sometimes keep in mind that, privilege and wealth can mask a lot of ADHD symptoms as well. Like, if you are a child with ADHD, but your parents can afford a private school where you're going to be one of 9 students in a class, well, your experience in school is going to be wildly different than, the typical public school, child who's in a class with 25, kids, which is, functioning differently. Or, you can afford tutors for that child. You can afford, certain supports that somebody else couldn't. And so sometimes we don't realize that can play a big factor in it. I'll ask people, even for adults, like, are there situations which you find impossible to do? And they might say no. But then I'll, inquire further whether they have people, that do that for them. And people who have means will say, oh yeah, I don't do any of that because I just hire someone to do it. Okay. Now, if you didn't have the money to do that, would that be difficult for you to do? And they'll say, oh my God, it'd be impossible. I don't know how people do that. I'm just glad people do that as a job, So we have to really get in there. And a lot of times with rating scales, with assessment, or people that don't understand ADHD, we'll ask those elementary questions and be like, check, check, check. Oh, no, you don't have ADHD. And sometimes it'll be check, check, check. You definitely have ADHD. And with either one, we can't be too quick. Because the truth is that although people think it's overdiagnosed, studies actually say that it's more underdiagnosed and unidentified in girls, in people who are more the inattentive type, and definitely in older people.
Right. All right. So it seems like there's a lot of people who's not identified. I would like to ask you just one last question then. And we've been talking a lot about different things here, but what would you say, like what would you say is the take home message from today's conversation?
I would say for people to, if they think they have ADHD, first and foremost, educate. Hear from the experts, people like Dr. Russell Barkley, people like Ned Hallowell. Go on, in the States, we have an organization called CHADD, CHADD. We have another organization, particularly for adults, called ADDA. It's the Attention Deficit Disorder Association. Go on their websites. Find out the right information, because there's a lot of misinformation out there on ADHD, probably more than any other condition that I work with. There are a lot of people who think they know what it is, and they don't. There's a great YouTube channel called How to ADHD. It's a young girl named Jessica McCabe, young woman, Jessica McCabe, who has these amazing videos, very colorful. I mean, she knows her audience. She has ADHD, and it's definitely appealing to young people, but to all ages. And she takes different topics within the ADHD world. Go on that. You can learn a lot in a 6-minute video that sums up, because what I hope that people get from this is, if they have ADHD, one, to be like, oh my gosh, that's me. Yeah. I feel validated by that, because I can tell you for myself, every time I read a scientific article and I continue as research is being done, I feel more and more the sense of my own validation of like, oh my gosh, like when I first found out that, about sleep disorders and why it was so common in people with ADD, I thought, oh, this makes total sense, because I have a lifetime history of sleep problems and sleep disorders, and, why I have an addictive personality, that all of these things help eliminate the sort of shame and judgment. So that's the number one takeaway. And then because if that shame and judgment is taken away, people now are open to availing themselves to treatment, to resources, to strategies. And that's how people succeed with this. You can be incredibly successful. And I guess the last takeaway is that when it's managed well, I love my brain. Like, I like my ADHD brain. I would definitely say it's responsible for a lot of the challenges or, darker moments. And it's also responsible for the brightest, most successful moments. And so it's like a coin to me. I can't throw away just the heads or the tails. It kind of comes as a package. But if you learn how to manage it, that same brain could be incredibly creative, could be entrepreneurial, could sort of assess situations super quickly. There's a professor at Syracuse University in the States named Johan Wicklund, he's in the business school there, and he does studies on looking at entrepreneurs with ADHD and visionaries, and finds that a lot of the traits like impulsivity and being out of the box are the same traits that people, inventors, and very creatively minded individuals do, and risk takers. It makes sense. I mean, if you're an entrepreneur, you have to be somebody who's good with risk and not totally afraid of failure. So there are a lot of benefits. If you know the show Shark Tank, that show that, of those sharks, 3 of them have dyslexia, one of them has ADHD. That's not coincidental. I mean, the entrepreneurial world is filled, the artistic world, musicians, artists, painters, filled with people with ADHD. And that's another thing. Go on Chad or Ada, Google celebrities that have ADHD, and especially for young people, if they're interested in sports, find out athletes who have ADHD. There are a lot of them, musicians, scientists, and to see that you're not alone and that you can be successful.
For sure. I think that is very, very good advice. Roberto, it's always nice talking to you. So I will again like to say big thank you for coming on and sharing your knowledge about this.
Absolutely. My pleasure.
Okay. Take care, Roberto.
Take care.
Hope you enjoyed the episode. Friends, I really need your help. I'm trying to get the podcast out there. So I was wondering if you could help me by leaving a positive rating and a review on your Apple device or the podcast player that you're using, as well as subscribing to the podcast. That really helps getting the show more visible on iTunes and other players. And if you don't know how it's done, then YouTube has a lot of great videos, so you can search there. All right, that's it. Take care.